We begin with baby selling. Investigators from the Economic and Organized Crimes Office are on the hunt for multiple agents linked to a baby harvesting and selling syndicate said to be buying and selling newborns off their unsuspecting mothers in Ghana and abroad. At least 4 babies have been rescued from the syndicate after a joint operation with the Medical and Dental Council in some health facilities in the Greater Accra region alone. So far, 11 persons have been arrested. We have details of the latest arrests and plans to track down the ringleaders. First, Manuel Kranting's report as officials of the 2 institutions mounted an operation to track those involved in the crime.
Selling and child trafficking becoming a booming business in Ghana, although an illegal enterprise. Under the cover of darkness, babies are stolen from their mothers right after birth and sold. The Economic and Organized Crime Office and the Medical and Dental Council have been engaged in a joint operation to unravel this blight on the nation's conscience. According to Executive Director of Yoko, Frank Edupoku, 3 of the babies who were sold have been rescued, with 1 still under investigation.
Of 31st December 2020, the last day of the year. As many people prepared to bid farewell to one year and welcome another, somewhere at the Tema General Hospital within the Tema metropolis, a baby was about seeing the last of his biological mother. In motion on that fateful day was the sale of a 1-month-old baby boy by an organized baby selling cartel. This syndicate is made up of several people, including doctors, nurses, and social welfare officers, among others, all of whom are entrusted with the responsibility of providing assistance to mothers and their newly born babies. Their operations had been on the radar of the Medical and Dental Council for a while, and today the council has teamed up with the officers from Economic and Organized Crime Office, Yoko, to foil one of such illegal transactions. The Connect, Leonard Able, an officer at the head office of the Department of Social Welfare, had already taken 10,000 Ghana cedis as a deposit for the baby, who he was selling at 28,000 Ghana cedis from a woman in need of a baby, not knowing she was an undercover officer with Yoko. The JoyNews team was embedded in the operation and filmed from a distance as Mr. Able went to collect the baby and accompanied the female undercover officer to a vehicle. This was the point of arrest. Leonard Able was arrested and the baby retrieved. On-site interrogations revealed Mr. Able was not alone. His accomplices, a nurse only identified as Nancy, and the head of the social welfare at the hospital, also referred to as Auntie Doris, had heard of the arrest and immediately bolted.
I've called her several times, but she's not picking up, so I keep on calling. I don't know what to do.
What is her name? What is her surname? There's a woman who left in the car, in the taxi.
She left in the taxi?
Yes. They gave money that I should go and pay them.
Okay, so what's the evidence that you paid?
Oh, so the woman said that.
Which woman?
Nancy said that she had done adoption before. And she said that she had somebody, she has a baby, an abandoned baby here. Doris said she had an abandoned baby here. You get me? So I should assist her in the baby is there. Somebody, if they have somebody.
Not even a call from the medical director of the facility could get them to return.
Can you come right away to my office? My general hospital, director's office. Yes.
The entire morning went by with the arrested suspect pleading for mercy as he sent the teen on a wild goose chase from one facility to the other in search of his other accomplices.
Yes, but the way my name, my this thing, I beg you. Help me, I beg you.
Yes. So
Help me.
I'm asking.
Can you go help me?
They give you money? They give you money? Did you take any money?
They give money that I should go and pay them.
Okay.
The day ended with one arrest as the task force worked other leads to effect more arrests. For JoyNews,
we apologize for that earlier mix-up with the reports. Let's move on with the story. Now today, IOCO and the Medical and Dental Council held a news conference where they gave an update on the operation so far. Kweku Asante was there for JoyNews.
Selling and child trafficking becoming a booming business in Ghana, although an illegal enterprise. Under the cover of darkness, babies are stolen from their mothers right after birth and sold. The Economic and Organized Crime Office and the Medical and Dental Council have been engaged in a joint operation to unravel this blight on the nation's conscience. According to Executive Director of IOCO, Frank Edupoku, 3 of the babies who were sold have been rescued, with 1 still under investigation.
Additional arrests have been made. 4 petitions, and in fact, I'm told as of yesterday, 2 other petitions had been sent to the office. And when we talk of petitions, we are talking of supposed victims who have had their child or children taken away from them, coming to make a case for us to investigate.
The dockets on the investigations will be sent to the Attorney General's office for advice and prosecution.
Arrest of Dr. Hope Kwashi Mensah, the notorious Susan Clinic. We mentioned Dr. Hope Kwashi Mensah as the one at the center of a syndicate based at Susan Clinic at Atebi Okoshi. And as we speak now, all the persons who had one way or the other to do with the case had been arrested and granted IOCO inquiry bail. The docket on Dr. Hope Kwashi Mensah, so far as the Susan Clinic is concerned, is almost ready, and we are just about submitting it to the Attorney General's office for advice and prosecution.
IOCO does not believe it should extend the investigations to other regions immediately.
This is a specialized type of investigation, and if you are not careful and you decide that all the regions should be involved in it, we are going to lose track of it, because we are very comfortable here because we are working hand in hand with the Medical and Dental Council. So going forward, if we're able to establish that relationship with all the regional, maybe dental, I don't know whether they have even offices in the regions, then we can maybe expand our investigations.
Meanwhile, some of these babies are sadly procured and attempts made to traffic them outside the country. For now, the pain and anguish of mothers who suspect that they are victims of this syndicate will continue to hope that justice will be served and such criminals will be rooted out of society.
Joining us now is the acting registrar of the Medical and Dental Council, Dr. Divine Banyubala. Thank you very much, Doctor, for joining us. First question is, how soon will these 4 rescued babies be reunited with their families?
Thank you very much, and thank you for having me. That is a difficult question to answer because it depends upon what the investigations throw out. And I would suppose that that would be, even if all of them are through to prosecution, that would be after the matters have been properly and fully determined. by a court of competent jurisdiction. So I wouldn't want to go into guessing as and when. But what I can assure you, as was made clear by my colleague, the executive director, is that these children that are currently in our custody, our joint custody, are in a very, very good place. They are safe, well, and being taken care of very well. And I can confirm that our team of investigators just returned from visiting the children today, and they report that all of them are in very good condition and are being taken good care of.
Now, that I'm sure is very reassuring to the family members, but are we able to connect each individual baby to the mother that gave birth to them? And will they have access to them in this safe place that they're being kept in the meantime that investigations are ongoing?
Thank you very much. I wish to further clarify and explain that. First, we have been able to connect 2 of the babies to their biological mothers. We have also been able to connect one of them to both their biological mother and biological father. The 3rd baby, we are not yet, and Yoko has not yet been able, our investigations have not yet been able to connect the baby, the 3rd baby, with the biological mother. But as I want to clarify that at this point, biological mothers or social mothers or foster mothers, those that are directly linked to an issue are suspects. And whether or not they are allowed any direct engaged contact with the children will depend upon what the outcomes of the investigations as they go on. And so I have no doubt that the cardinal principle underpinning the children issues in accordance with our Constitution and the Children's Act is the best interest of the child, the welfare principle. And I want to further assure you that we are acutely aware of our obligations under the laws of Ghana to make sure that at all times we act in the best interest of these children, and that is how they are being managed at this stage.
Pardon me, Doctor, I just want to get this quick clarification. Is it the position of Yoko and the Medical and Dental Council that those biological mothers out there could be complicit in selling their own babies?
Once you have investigations and then they have not yet been fully concluded and charges drafted, it may be possible that they were victims of the entire situation. It may also be possible that they were conspirators or willful participants. But all of these are matters of facts to be established. And it is only when the charges are being framed that full investigations and facts show that the mothers were actually victims of the circumstances. Then they not only may have access, because remember that having access to children of this nature will require what we call a complete social inquiry by the department that has the statutory obligation to do that, the Social Welfare Department of the Ministry of Gender, Children and Social Protection. And therefore, what I want to state now is that we are not yet clear, we have not made a definitive statement as to the culpability or the level of involvement of the mothers and whether these biological mothers are going to be witnesses or they are going to be suspects or charged as well as being complicit.
Right. Doctor, how large is this group really? Our report is that there's still a manhunt for members of this group, possibly the ringleaders, but 11 people have been picked up already. Do we have an idea how many people are really involved in this?
Well, we will never have an idea. It's almost like, the tip of the iceberg. And I keep telling people that this is a focused, specialized investigation. And therefore, we can only talk about where the facts have led us. And as we know it, we have 2 medical doctors who are involved in this enterprise. We have persons who said they are nurses or auxiliary nurses involved. We have persons who, at least one traditional birth attendant who is involved. We have a retired social welfare officer and current serving social welfare officer involved. We have a nurse who is involved, and that nurse has been picked as an additional part of the updates we gave today. The nurse who was in charge of the Tema General Hospital's in neonatal intensive care unit, called Nelly, was also picked as a suspect. And it will be at the level of advice in terms of framing the charges that, based upon the Attorney General's guidance, we may determine whether some of these persons will be used as witnesses of the state or may actually be deemed culpable and therefore be treated as suspects in the matter.
Right.
So we cannot determine the extent, but what we want to assure the public is that the health sector regulatory agencies are up to the task, and we are coordinating our regulatory efforts and working together to ensure that we continuously adjust our quality assurance processes and management systems, not only to deliver quality healthcare services, but also safe care, and to assure the security, the human security, personal security of all persons engaging our healthcare system.
Okay. Now, the executive director for IOCO mentioned that the possibility of carrying out this investigation on a regional level also depends on the presence of the Ghana Medical and Dental Council at the regional level. Do you have this capacity? And are you able to support an investigation in other parts of the country?
What I will state is that it is our public obligation to support any state agency desirous of conducting whatever investigations that requires our technical support. And whether within the boundaries of this country or outside of it, we are going to reach within the limited resources that we have to ensure that we deliver on that mandate. So to answer your question, first, we do not have regional offices. We currently have zonal offices, one located at the regional directorate of the Northern Regional Health Directorate in Tamale, 7 that segment of the country. We have one located at Edum, Kumasi, 7 the central part of the country. And then we have our head office located here in Ajabin and Accra. And we have a new office zonal office we opened in Sekendita Kradi only October last year. And within the current constraints, we are working hard to incrementally increase our presence, and the overall long-term objective is to increase our presence in every region. But currently, we are only in 4 zones. But also to add that it doesn't matter whether or not we are present in the region is not the issue. Once our investigations lead us there, we will bring our expertise to bear on any agency that wishes to conduct investigations of this nature or like manner in any of the administrative regions or districts in this country.
Finally, Doctor, one name kept coming up in Mr. Dupoku's news conference, one Dr. Kwashi, and there was the name of a notorious hospital mentioned here in Accra. Is that to suggest that Dr. Kwashi is the ringleader of this entire enterprise?
Not at all. What we do know is that this is a complex network of persons very organized, involved in unlawful acts. Now, currently the facts show that 2 out of the 3 babies in our custody, 2 of them trace their source to Susan Clinic and link Dr. Opashi Mensah directly as the person who was at the helm of that. So out of the 3 we have, 2 of them are there. The third one, as you already know, is the baby that was procured through Dr. Noah Kofilate of Dangbe Community Hospital in Prampram, and he got the baby sent to Tema General Hospital, the neonatal intensive care unit, where Doris Bedu and Nelly and Obaya Frimpong, Nancy Obaya Frimpong, then supported to ensure that the baby was sold to us at 28,000 Ghana cedis. So it's early days yet to be able to pinpoint a single person. What is clear there is that what is beyond doubt now.
Dr. Divine Banyubala there, but most of the clear facts were established in that interview.